Sunday, everyone. One dope psychologist here, Dr. Natalie Whitlow, and I'm here today to talk to you about depression. The other day I put up a video, a quick video, a 2-minute video, just giving some overviews of depression because we are in the first month of the year, and this month has the highest suicide rates. And so I thought it was important just to give a brief overview of what depression is and how you can recognize it. Well, today I wanted to do a video that's a bit more in depth to give you a bit more information on depression. So first thing, whenever I'm doing a presentation on depression, people ask me, why are we talking about this? Everybody knows what depression is. Depression is common. I feel like I have a handle on what it means, and I always say that's the exact reason that I want to do a presentation on it. This is the exact reason I want to talk to you about it, because depression is so common. And because it's so common, it's a threat to us. How? Well, one, because of the fact that it's so common, we feel that we know all of the effects of it, and we don't concern ourselves with the effects of depression. We simply allow them to be and run their course. We treat depression kind of like a cold. When we're having symptoms, our throat is sore, we're feeling fatigued, we can't breathe. If we're concerned that it might be the flu, if we're concerned that it might be strep throat, then we want to jump into action and treat it. But the minute we find out it's a cold, oh, okay, we might take some over-the-counter meds, we might not. People treat depression in the same way. Once they find that, oh, this is just some depression that I'm dealing with, then they stop being concerned about the effects of the depression on them. That scares me as a psychologist, because what I know is if we leave those depression symptoms untreated, just like anything else, the symptoms will get bigger. And then they'll get to a point where you are concerned about them. And if we can stop them from getting bigger on the front end, we don't have to worry about that mental health crisis on the back end. The second reason that depression being so common is a threat, and why we need to talk about it, is the fact that we feel like we understand depression more than we really do. And so because we feel like we understand depression more than we do, we don't know the full range of what depression looks like. Yeah, I know depression means I'm sad, I might be crying, I might be disengaged, but we don't, that's only one portion of what depression is, and we don't understand the full range of what it is. And that's a part of what we'll talk about today a little later. What is the full look of depression? And then the last reason that depression being so common can be a threat to us and can be a problem is because we won't seek the treatment that we need for it. Again, we feel like, oh, it's commonplace, it's nothing to worry about. And in a lot of cases, it's nothing to get your life turned upside down about, but it is something to responsibly deal with and look at. And so these are the reasons that I want us to talk about depression and get that idea of, oh, it's common, I know what it is, we don't need to talk about that anymore out of our heads. So now we talked about the fact that depression is on a spectrum. Depression can range from being very mild, a manageable condition that does not impact our lives. It can move to the middle of that spectrum and become a moderate condition where we still have some control over it. We're still able to function, but the symptoms do have periods of times when they overtake us and we're not able to function like we want to. And then on the other end of the spectrum, the depression can become severe. It can debilitate the way that we function, and it can completely shut us down. And so we have to remember that. And the thing about it being on a spectrum is that we don't have to just solely be mild and we're on the mild end. We can fluctuate back and forth, right? So in a week, you can be mild one day, by Thursday you've hit the severe range, and then you kind of move back to a middle point. That's how depression works. And again, if we can keep the depression symptoms from even going to the severe point at all, that would be the goal. Okay, so what is depression? Again, we know that it means that we feel sad, we're not feeling good inside. But the way that I like to think about depression is, I call it a lack of phenomenon. When you're depressed, it means that you're down, there's a decrease in you and the way that you function in some way. And that's where I get that lack of phenomenon from. There's a lack of energy, drive, motivation, and commitment to do things. There's a lack of hope, a lack of feeling happy and satisfied just with the everyday things that we should typically feel good about. There is a lack of inner peace that we have. And then when depression becomes so severe, there's a lack of will to live. And that's when people become suicidal. So just to talk about suicide for one moment. So we have suicidal ideation, and then we have suicide attempts. Suicidal ideation is when you're thinking about death, thinking about dying, thinking about not wanting to be here. And then of course the suicide attempt is when you actually make an attempt to kill yourself. And so again, just like with anything else, our suicidal ideation runs on a spectrum. So our suicidal ideation could be fleeting. We don't have any real intentions of doing anything, but because we're stressed about something, just the idea of me not being here, alleviating my problem runs through our mind. Or that suicidal ideation can be severe, where you're thinking about it multiple times per day. You've even thought about ways that you could kill yourself. Maybe you've even secured the means. So you said, I think the easiest way would be to shoot myself. And then you go out and buy a gun and you have it there. Maybe you've held it, you put it to your head, you toyed with it. So that's suicidal ideation as well. And again, we don't want it to get to the severe point. We want to stop it while you're still using it just as a way of coping. When things get so hard, oh, maybe I'll just die and it'll be better. We want it to stop there. We don't want it to grow and become a suicide attempt. So now, let's talk about the different types of depression. Now that we understand that depression is simply a lack of phenomenon, when you feel this decrease in feelings, in thoughts, in desire to behave, desire to live. So now, what are the different types of depression? As a psychologist, when I'm diagnosing someone with depression, I use what's called the DSM-5, the Diagnostic and Statistical Manual, and this is the 5th edition at this point. And so in the DSM-5, there are two major types of depression. You have major depressive disorder, and then you have persistent depressive disorder. Major depressive disorder hits all those major symptoms of depression that we know about: feeling sad, being disengaged, having a hard time thinking and concentrating, withdrawing yourself. But in addition to all those symptoms we think of on a day-to-day basis, it also includes that severe suicidal ideation. And in order to qualify to be diagnosed with major depressive disorder, you have to have your symptoms for 2 consistent weeks. So every day for 2 weeks, you are dealing with depression for the great majority of the day. So yes, all it takes is 2 weeks for your symptoms of depression to move from simply being symptoms to actually being a diagnosis of major depressive disorder. And then persistent depressive disorder, this is something that we diagnose after a 2-year period. So when you've had a 2-year period of mild to moderate symptoms of depression, so you're not feeling suicidal, you're not unable to function in life, but you have this hovering feeling of sadness, having a hard time concentrating, having a hard time starting your day and wanting to get out of bed. Maybe you have a hard time sleeping at night, those kinds of things, but you still can function and engage in your life. And if you've been dealing with that for 2 years and have been unable to shake that feeling, then we diagnose a persistent depressive disorder. Now, outside of those DSM diagnoses, I also want to talk to you about some specific types of depression. So the first one is SAD, S-A-D, seasonal affective disorder. And this is a type of sadness and depression that comes on during the winter months. We don't fully understand why, but what we do know is that the lack of sunlight that we get during the summer months contributes to SAD. because the sunlight gives us vitamin D. The vitamin D then activates the neurotransmitters in our brain that make us feel happy, and so we're able to feel more happy and fight off being depressed. But during the winter months, when the sun is not out as much, we're not getting the vitamin D that we need, so our neurotransmitters activity is lower, which means that our ability to be happy is lower. After seasonal affective, we have postpartum depression, and this is the type of depression that women who have just had children experience. So women, they can still, while they're pregnant, develop postpartum, and you can develop it all the way through your child being 12 months old. So that year and a half period of time, postpartum depression in women who have just had babies can happen. So one, we know that it can happen because of hormonal changes. Being pregnant, carrying a child can cause hormonal changes that can throw off your chemical balance and cause depression to come on. But postpartum depression can also come on from the psychosocial stressors that a new mother is experiencing. The fact that she's not getting the kind of sleep that she needs, the fact that she's not on a schedule that is balanced and equal, the fact that she now has to care for the needs of another life and put her needs on the back burner. She's unable to move and do the things that she used to do when she wanted, how she wanted, because she now has a child. So those changes in life, the financial stress that comes along with having a child, those things can thwart or push someone into a depressed state. You have a situational depression, which simply means based off a situation that we're in, depression symptoms come up. So you may not get a diagnosis because of this, but you still are dealing with viable symptoms. And it's very important to understand that, because people sometimes, I'm not depressed, you may not need a diagnosis, but if it's a symptom, it's still something that you want to address and treat so that it doesn't get so severe that it becomes a diagnosis. There are psychosocial related depression diagnoses that you can have just off of the social stressors that you're dealing with. If you're a woman who is dealing with some gender bias at work, if you are a male of color who is dealing with racism in the world, if you are a single mother who is dealing with the biases and the prejudices about being a single mother. So there are all these different psychosocial or social environment related stressors that can then trigger symptoms of depression. There's genetically predisposed depression, meaning that depression runs through your family. And so because of the fact that depression runs through your family, you have a higher rate of potentially developing depression. Now, it's important to say that alone, just because you have someone else in your family that's been diagnosed with depression, that alone does not mean that you will be diagnosed with depression. But what it does mean is that you now have an increased chance of developing depression. So if you couple you having a genetic predisposition with an outside stressor that you're dealing with a hormonal change that you're dealing with, now you have a greater chance to develop depression than someone else who does not have depression running in their family. And then lastly, there is functional depression. And this is when someone deals with all of the severe symptoms of depression, but they're still able to function. So the people on the outside in their outside world don't know that they're dealing with depression at all, because they're still able to get up and go to work. They're still able to be a part of the church board. They're still able to parent and take care of those responsibilities. And so, quick fact, the type of depression that has the highest rate of suicide is a functional depressed person, a functionally depressed person. And why is that? Because that is the person who has enough belief in themselves and in their ability to complete the act of suicide that they will do it. Someone who's severely depressed, they're so down, they don't believe in themselves, they feel like they're not worthy, they don't try because they don't believe that they can complete. But the person who's been able to still function and make things happen in their life with their depression, they also know, and if I try to commit suicide, I will complete. So the functionally depressed person, the one that you and I are most willing or most we typically look over them the most. That's the one who's at the most risk of committing suicide. All right, so really quickly, this will be my last point. Let's talk about the different looks of depression outside of what we typically know it to be. Someone who has poor hygiene, who's disheveled and unkept, is someone who may be dealing with depression. We like to just throw them off and say, oh, they nasty. They don't know how to keep up with themselves. They weren't taught well how to keep up with themselves. Maybe it's not that. Maybe it's that they're depressed. The person who is disengaged, who seems to be disinterested, who is minimally involved in conversations and in interactions with people, could very likely be dealing with depression. We like to call those people antisocial. He don't really deal with people. She don't deal with people. I'd rather not be around her. Maybe it's not that they don't want to be around people. Maybe it's that they're depressed and that they are trapped and being held right now by the depression that they're dealing with. Someone who comes across as defensive, snappy, and aggressive could be dealing with depression, because anger and agitation is a symptom of depression. So instead of writing someone off and just saying that they are angry and unpleasant to be around, they got problems, think about it as maybe they're dealing with some depression. People who back out on plans. So they make plans and they lead you on to believe that they're going to be involved, but then they end up backing out of those plans. Maybe those people really aren't flakes. Maybe those people aren't unreliable people. Maybe they're dealing with depression, and every time the time comes for them to interact in public with people, that depression comes over them, making them feel like they're not good enough. So that's why they back out. People who don't put forth full effort in tasks and activities. Maybe it's not that they're lazy. Maybe it's not that they want someone else to do all their work for them. Maybe it's that they're depressed. And so what they're giving you is all the energy that they can muster up to give. People who are constantly thinking, having racing thoughts, excessively thinking about things, overthinking things all the time. Maybe these aren't people who are busybodies, people trying to cause problems or look for problems. Maybe it's that they're depressed, and their depression is on them so hard that it's causing their minds to go a mile a minute trying to figure out and find solutions of, how can I deal with this depression? What can make me happy? Psychosis is something that people don't typically relate to depression. So what is psychosis? Psychosis simply means that there are periods of time when you are disconnected from reality, paranoia, and hallucinations. So with paranoia, someone with depression who already feels a low sense of self-worth may feel like everyone else can see that they are not good enough. And so now they believe that people are laughing at them, ridiculing them, and talking about them for not being good enough. And they're paranoid because people really aren't. Then you have an auditory hallucination, which is when people hear things that aren't there. Auditory hallucination means that people hear things that aren't there. You'll often hear people saying they hear someone calling their name, and they'll ask the other person in the room, did you hear that? Person will tell them they're tripping. No, I didn't hear anything. A visual hallucination is when a person sees something that's not there. They catch shadows out the side of their eye. They believe that someone was walking past, but they weren't walking past. Often hear people talking about insects or critters that they see crawling, and then when they look, they're no longer there. So these visual hallucinations, where the depression can become so severe that it starts to play tricks on your mind, and so your mind starts to perceive things that aren't there. Perceiving that people are laughing at you, perceiving that you're hearing and picking up on auditory sounds that aren't there, perceiving that you see things that are not there. But that comes from the severity of the depression and the tricks that it can play on your mind. Lastly, there is the physical pain piece. We're starting to talk about that a little more, so we understand that yes, depression can hurt in a physical way, but I just want to reinforce that there can be muscle and joint pain and fatigue that literally causes you not to be able to move as quickly, to have to slow down, not to have that vigor for engaging in life because you are physically in pain. So I want to thank you all for taking the time to watch the video. I hope that this helped just to get a greater understanding of what depression is. Now in the future, my other videos will help you to understand deeper other mental health concepts, and then we'll also talk about ways that you can begin to treat and deal with some of the symptoms that we're dealing with. The reason we didn't talk about that today is because there's not a set way to deal with depression or any other mental health condition, because what helped me deal with my depression may not be what helps you. Depression and other mental health conditions are such unique experiences to the individual person. Why wouldn't treatment be the same thing? Treatment is so unique to the individual person. But I will say, if there's anything in this video that connected with you and resonated with you, and you feel like, I want to explore this more, I would definitely say get yourself a therapist. You can look at your private insurance and see what providers are available in your area who are covered by your insurance. If you don't have insurance, there are free clinics that you can go to that will offer you this therapy. And you can also go to other community mental health centers, and they can see you on a sliding fee scale, which is where they look at your income and then they base what they charge you off of that. So don't let not knowing how to get a therapist stop you from doing it, because I've just shared it with you. So I'm looking forward to you all coming back next time and viewing the video. If you like what you see, please subscribe to my channel, One Dope Psychologist. If you think there's someone else who can benefit from the things that I'm sharing, please have them come on along and subscribe to my channel. And I look forward to bringing my next video to you soon.